developed most robustly is through the consensus of multi-stakeholders coming together and agreeing to share that kind of information with the public. More needs to be there, of course. And I think that there's a lot of interest in working on identify the kinds of information that consumers want in order to empower them and also allow them to make better choices.
Great, thank you. All right, so the next couple of questions are actually for California. So the first question we have from an audience member, how would you enhance physicians' involvement in quality improvement and patient safety? Do you have recommendations?
Excuse me, great question. One of the specific ways, let me give it a little context. The MEDCAL program in California is well on its way to becoming predominantly managed care delivered through health plans. Probably before too long, in a year or two, will probably be about 90% plus capitated care or managed care through health plans. So we've created a working group with our health plan medical directors. We meet with them quarterly, but we've created a working group to engage them on that very subject, which is how to think all onto the individual clinic, hospital, counter level, moving up to the medical group plan level, et cetera. In states that are heavily capitated, there are all these layers to work with. So we have to try to think about the not catalyst, but the kind of action points where we can actually impact things. So that's one area of engagement through our health plan medical directors. Way we're reaching out is certainly through individual professional societies, certainly the primary care organizations. That's been another valuable means of getting a stakeholder input. For example, on this quality strategy, when we presented it, we sent it out to, I think we have several thousand stakeholders, including professional societies, federally qualified health centers, the whole gamut in the healthcare delivery system. And got responses back from quite a number of individual stakeholders. So it's a great question. It's not one that's easy to answer. Everyone is super busy, so I think looking at different channels is something that's critical. So at that, because we could spend all afternoon. Great question, though.
This is Nancy. I would just add that clearly within the delivery system, with hospitals, the culture of quality improvements by the leadership supports that engagement, and you have to free people up to be able to do it. It's also, I think, a growing movement for teaching quality improvement in training for clinicians, so that it becomes part of what their expectation is, that and in fact there's more enjoyment with it. So I think we're in the right direction. And very, very practical basis, I know that for ambulatory physicians in private practices, sometimes healthcare systems pay them a small amount of money to participate because of giving up a day's work. And that has been an effective tool. It doesn't the money they would make if they stayed seeing patients all day, but what the reports are is that they feel respected.
Great. All right, the next question is also for California. This is actually a question from another state. It's from a private physician-owned pediatric clinic that's making efforts and working hard towards achieving, I won't go into specific details, but a certain level of recognition for the patient-centered medical home. And while there is commitment to the national quality strategy, the clinic's having a little bit of a hard time getting the same commitment from the state. Any recommendations for California on ways to get the state on board?
So I don't know if we can get the clarity by the state. I'm going to assume they mean the state Medicaid agency. I'll just take that because I don't know if we're going to be able to validate my assumption, but I'll assume it's because like us, we're state Medicaid, Medi-Cal. Well, I think that we work, and probably our sister agencies around the country as well. The input from stakeholders is very important. Take it as very important feedback input. So we're ready to meet by phone, in person, all of the above to gather with other stakeholders, and we don't know all the backdrop, unfortunately, but I mean, reaching out directly and talking about what the particular challenges are, what the concerns are, I would certainly encourage that. So assuming that's been done, our agency is huge. It is 3,000 people. So if you have not reached out perhaps to the medical director in particular, if there's a director of quality, or if you're in a managed care environment, we have two large entities, basically divisions, one working in managed care, the other in fee-for-service. I wouldn't assume that if you, for unfortunate reasons, got a cold reception, med agencies tend to be pretty big, so don't give up. Try some other targets within the agency. As I said, if you haven't reached out to the medical director, that's probably the first place I would think about. And if it's divided up into other domains like fee-for-service or managed care, depending on your area of practice, you might try that also. I wish I had more of the context, but that's what I'm trying to piece together.
And you're welcome to email me offline, and we can try to see if and I can include Neil on that email, and if we can't, I'll give you any more detailed advice or make a connection for you.
Yeah, great. Thanks, Nancy.
Great, thank you. All right, so we have another question I think that would be great for both Dr. Wilson and for our California presenters. The question is, when you talk about training healthcare workers on quality improvement, what would your recommended approach for that be? What would that look like? And could you provide some resources?
Yeah. There are different approaches that are happening. There's a patient safety education group that's been developing curriculum where you can go online to learn some of the basics of patient safety and how to improve patient safety within your practice. I think in the hospital setting, some of the best practices are leadership institutes and I would actually go to the American Hospital Association Quest for Quality area and read about this is an award that we've been handing out for 10 years. I happen to be one of the judges, which is why I know this, and there are descriptions of various places and what they've been doing to support staff and engage staff in quality improvement. I think there's also, just in general, the AHA could give you some pointers. That training can sometimes be a funny word and sounds like you're forced in a room all day. I think participation in improvement activities, so experiential learning, adult principles of learning, are a great way. And sometimes it's just trying to find a champion or two to has credibility with peers that can get that started. So Neil, I don't know if you want to add more to that.
No, that's great. I'm going to see, Desiree, did you want to comment on? I'm going to go over to Desiree because she has some great ideas based and some of the partners that she has at UC Davis that we have.
We're working with physician Dr. Ulfat Sheikh with the UC Davis Health Systems Institute for Population Health Improvement, and she is the Director of Quality Improvement within the health system. And she's brought a lot of